Hi, welcome to Counseling Techniques. I'm really glad you're here. This course is where we start building the foundation for your work as a counselor. Over the next several weeks, we're going to slow down and focus on the basics: how to listen deeply, how to invite a client to open up, how to stay present when things get hard, and how to build space where real change can happen. So, these are not going to be flashy skills. They don't come with instant feedback or gold stars. They don't always even feel correct in the moment. They might feel a little clunky as you practice them, but they are the core of counseling. Every good technique, every treatment model, every breakthrough moment with the client, it all starts with these basics. So before we dive into the skills themselves, I want you to take a few minutes to think about something bigger. Why are you here? Why did you decide to become a counselor? Most people don't stumble into this profession by accident. Maybe it was personal experience, somebody who showed up for you when you needed it, or maybe you were always the person that your friends came to when they were struggling. Maybe you just know that deep down, people deserve to be heard and understood, and you want to be part of offering that. Whatever it was, it mattered enough to get you this far. So hold on to that. That why that you carry with you is just as important as any technique that you'll ever learn. Because counseling isn't about fixing people, it's about walking alongside them. It's about holding space when there are no easy answers, and it's about believing that healing is possible even when somebody else can't see it. There will be days when this work feels heavy. There will be sessions where you don't know what to say. And there will be moments when doubt will creep in, or maybe that imposter syndrome. And it's your why, your reason for being here, that's going to keep you steady. So, as we get started today and in this course, I invite you to really sit with that question: why counseling? Why you? Why now? Write it down if you want. Come back to it when things get tough. It is part of the foundation that we're building, just like the skills that we're about to learn. So now that you've taken a minute to think about why you're here, let's talk about something that often gets overlooked early on. How is counseling different from just being a good listener or giving advice? At first glance, counseling can look like helping. You're listening, you care, you want people to feel better. But counseling is something much more intentional than helping somebody through a rough patch. Counseling is a professional relationship with a clear purpose. It's structured, it's goal directed, and it's bound by ethics, confidentiality, and accountability. When you're a counselor, you aren't just being a good person, you're taking on a professional role with real responsibility attached to it. There are a few important differences that set counseling apart. The first being training and education. Becoming a counselor requires years of focused training, not just in techniques and theories, but also in ethics, human development, multicultural competence, and clinical skills. You're learning how to hold space for somebody else's story without getting pulled under by it. You're learning how to notice patterns, ask deeper questions, and support change without imposing your own agenda. A lot of people in your life may be natural helpers, but training turns that instinct into a skill set, one that's intentional, informed, and ethical. Training isn't about losing your heart, it's about giving it structure. And one of the next differences that I want to talk about is clear purpose and boundaries. In everyday helping, relationships are mutual. You share, they share, you lean on each other. It flows back and forth. In counseling, the focus is one way: it's about the client. That means that you'll set boundaries around self disclosure, emotional involvement, and time. You'll think carefully about how much you reveal about your own life and why. You'll know where the edge is between being supportive and being enmeshed. Boundaries aren't about being cold, they're about keeping the relationship safe for the client and for you. Another difference here is the contractual relationship. Counseling is different because it's formalized. There's usually an agreement or a contract, written or verbal, that lays out what the client can expect, what your role is, how confidentiality works, and how long you'll work together. Clients know this isn't a friendship, it's a professional relationship built with trust and purpose. And because it's time limited, part of your job is actually helping clients prepare to not need you anymore. That might sound strange now, but counseling is meant to be a bridge, not a forever home. And these differences all matter because they protect both the counselor and the client. They create an environment where clients can open up without worrying about judgment, favoritism, or hidden obligations. When you have strong training, clear purpose, healthy boundaries, and a structured relationship, clients get something rare. They get a place where they're the focus, they get a relationship that's safe and consistent, and a helper who isn't looking to get something back. And for you as a counselor, it helps you sustain this work without burning out. It lets you keep your personal life separate, and it helps you be more effective, more ethical, and more grounded. So as we move through this course, keep that lens in mind. We're not just practicing helping, we're practicing professional, intentional counseling, and that makes a difference. So now that we've talked about what sets counseling apart from everyday helping, let's dig into the heart of what makes counseling actually work: the relationship between you and your client. Skills matter, techniques matter. That's why you're in this course to begin with. But research and a lot of real world experience tells us that the number one factor in whether a client gets better is the strength of the therapeutic relationship. In other words, it's not about what you do, it's about how your client experiences you. Clients are willing to take risks, to open up, to explore hard parts of themselves because they trust you, not because you said the perfect thing or used the perfect technique. Without a strong relationship, all the best skills in the world won't get you very far. So, what makes an effective therapeutic relationship? There are a few qualities that show up again and again when we look at strong counseling relationships, the first being trust. Trust is earned, not assumed. From the first session, your client is watching if you're really listening. Do you keep your word? Are you consistent? Are you reliable? And do you respect their story, even when it's messy or uncomfortable? Trust builds when your client knows that they can bring all of themselves into the room, not just the parts that they think would be easy for you to hear. The next quality is safety. Emotional safety is just as important as physical safety. Clients need to know that you won't shame them, you won't judge them, and you won't betray their confidence. Safety also means clarity. Being clear about your role, your boundaries, and your expectations actually helps clients relax. It lets them stop guessing and start doing the hard work of healing. And another quality is the focus on the client's growth. In counseling, the client's needs, goals, and growth are the center of everything, not your agenda, not your curiosity, not your need to fix. The focus is powerful because for many clients, it's the first time somebody has truly prioritized their growth without strings attached. It gives them permission to show up as they are and the space to imagine who they might become. So, all of this sounds really good in theory. In practice, though, there are some real challenges that come up in the counselor client relationship. One of them is that you're not always going to like your clients. Some clients will frustrate you. Some will remind you of people that you've had hard experiences with. Some will hold beliefs or make choices that clash with your own values, and that's normal. You do not have to like every client, but you do need to respect every client, to see their humanity, to honor their dignity, and to commit to their growth. And the ability to hold respect, even when liking isn't there, is one of the most important muscles that you'll build as a counselor, and sometimes it's also referred to as unconditional positive regard. Another challenge might be maintaining boundaries. When clients share their pain and their stories with you, it can create a strong emotional pull. It might feel natural to want to comfort them the way that you would a friend, by sharing your own experiences, making promises, or even being available outside of sessions. But part of the strength of the counseling relationship comes from its boundaries. Clients need you to be their counselor, not their friend, not their rescuer, not their family member. They already have those. The structure of clear roles, limited contact outside of session, and a time-bound relationship gives clients the best chance to grow independently, not to become reliant on you. It also protects you from burnout because carrying the emotional load of every client without boundaries isn't sustainable. So, bringing it all together, the therapeutic relationship is a kind of container. It's a space that holds the client safely enough that they can risk being honest, being vulnerable, and trying new ways of being. Your skills are important, but it's the relationship that gives those skills their power. Throughout this course, and honestly, throughout your whole career, you'll keep coming back to this foundation. Am I creating a relationship where this client can grow? This question matters more than any technique that you'll ever learn, I promise. So now that we've talked about why the relationship matters so much, the next question is, how do you actually build that kind of relationship? It doesn't happen by accident, and it doesn't happen through skills. It's not just who you are, but what you do when you're in the room with the client. Throughout this course, we're going to focus on practicing specific counseling skills that help you create the kind of space where clients feel heard, understood, and motivated to grow. These skills are your foundation, no matter what theory you eventually practice, no matter who you work with. So let's walk through the categories of skills that you're going to be learning in this course. The first is invitational skills, and that's what we use to invite a client to share. This happens through both your nonverbal body language, how you sit, how you look at them, how you show that you're listening, and your opening words. Things like, hey, can you tell me a little bit about what brings you in today? Or what would feel most helpful for us to focus on now? It's about creating a welcoming atmosphere without forcing anything. So an example could be, imagine a client walks into your office for the first time, nervous and unsure where to start. Instead of bombarding them with questions, you sit comfortably, make steady eye contact, and say, take your time. I'm here whenever you're ready to begin. That simple invitation can lower anxiety and open the door to real conversation. The next is reflecting skills. And sometimes we talk about reflecting feelings and reflecting meaning. So, reflecting skills just help show the client that you really understand them, not just the facts that they're sharing, but the emotions and the meaning behind those facts. Reflection will happen in two main ways. When we're reflecting feelings, we are naming the emotion that you hear beneath the words. When we're reflecting meaning, we're picking up on what the situation means to the client personally. So, an example of reflecting feelings might be something like the client says, I just can't seem to get through to my partner no matter what I do. You might reflect back, it sounds like you're feeling frustrated and maybe a little hopeless about the situation. An example of reflecting meaning would be to the same client, you would instead reflect, it seems like this relationship is really important to you and not feeling heard feels painful. These reflections help clients feel seen at a deeper level, and often that's when the real exploration starts. And then moving on to challenging skills. They are about gently and respectfully confronting inconsistencies, blind spots, or stuck patterns that you notice. When you're challenging or confronting, you're not being aggressive. You're just holding up a mirror and inviting the client to look more closely. So, an example here would be a client saying, I want to get healthier, but also mentions, I don't have time to exercise or cook. Fast food's just easier. So, you might say a challenge like, I'm hearing that health is important to you and also that some of your current routines make it hard to prioritize that goal. Can we explore that tension together? Good challenges are based in empathy, not judgment. They invite curiosity, not defensiveness. And then goal setting skills are really important because counseling isn't just about talking, it's about working towards meaningful change. Goal setting skills help you and the client figure out what are we working on together? How will we know if things are getting better? And what does success look like to this client? So, an example here would be if the client says, I want to feel less anxious. You might help them narrow it down by asking, what would feeling less anxious look like in your daily life? Are there specific situations where you'd want to feel more confident? Setting clear, client centered goals gives direction to your work. It helps sessions stay focused and helps clients see their progress. And then lastly, we're going to talk about change techniques. And these are the skills that help clients actually move forward once they're ready. These techniques might include helping them brainstorm options, reinforcing their strengths, offering new perspectives, and practicing new behaviors. So, an example here would be maybe a client identifies that they shut down during conflict with their partner. A change technique could be role playing conversations where they practice naming their feelings calmly instead of shutting down. Change techniques don't mean that you push clients to fix themselves immediately. You walk with them, supporting their readiness, celebrating small wins, and adjusting the plan when things don't go as expected. Each skill that we practice this semester builds on the others. Invitational skills create the opening, reflecting skills deepen understanding, challenging skills help break the stuck patterns, goal setting skills give direction, and change technique support action. And through all of it, you're strengthening the therapeutic relationship, the very heart of effective counseling. None of these skills are about being perfect, they're about being real, being attuned, and being committed to the client's growth. This week, we're going to start with those first most important moves, invitational skills, and practice how to open the door for a client to begin their story. So, looking at that very first building block of counseling, how do we invite a client to open up? When somebody walks into your office, especially for the first time, there's often a lot going on underneath the surface. They might be nervous, unsure of you, unsure of themselves, or overwhelmed where to start. Your first job is to create space that says, without rushing or forcing, it's okay. You can talk. I'm here to listen. And we do that through two main kinds of skills: nonverbal attending skills and verbal opening skills. Nonverbal attending is the ways that you show that you're present without saying a word. It includes your posture. Are you facing the client in an open and relaxed way, or do you have your arms crossed and look closed off? Your eye contact, steady but not staring. Definitely don't stare at your clients. It's weird. And your facial expressions, showing interest and warmth. And finally, your body language, nodding slightly, leaning in just enough to show engagement. So, an example could be imagine a client sitting across from you, you're slouched, arms crossed, glancing at your watch. Maybe you're even texting on your phone. You're signaling disinterest, even if your words sound kind. If you're sitting upright, facing them, giving gentle nods as they speak, you're silently telling them, I'm with you. Clients pick up on these nonverbals quickly, often faster than on what we say. So, part of your role is learning to be conscious of what your body is communicating, not just your words. And then looking at verbal opening skills. These are simple statements or questions that encourage the client to begin sharing. They sound like, where would you like to start today? What feels most important for you to talk about right now? Take your time. I'm here when you're ready. These are open invitations, not pressure. You're giving them permission to step into a space at their own pace. And one of the hardest, most powerful parts of invitational skills is learning to tolerate silence. After you ask an opening question or after the client finishes speaking, you don't have to jump in right away. Silence gives the clients room to reflect, to feel, and to find their own words. If you rush to fill every pause, you may accidentally shut down something important that's just starting to surface. So, pacing matters. Clients need to feel like they can go at their own speed, not yours. Some clients will dive right in, others will need time. Your role is to match their pace, not set it. So, these invitational skills are about creating quiet, steady presence that makes it safe for clients to start talking and to keep talking. Through your body language, your gentle opening words, and your willingness to sit with silence, you're sending a powerful message. This is your space. You matter. I'm here. So, I want to do a little bit of a deeper dive into nonverbal communication. This is everything that you communicate without using words. And here's the thing, most of what we communicate isn't about what we say out loud. It's what we do with our face, our body, our voice, even our silence. In fact, research suggests that as much as 80% of communication is nonverbal, which explains why you can tell your friend that you're fine. But if you have your arms crossed, a dead stare, and heavy sighs, that might say otherwise. In counseling, being aware of nonverbal communication, yours and your clients, is critical. It helps you pick up on feelings when words don't catch. It helps you build trust. It helps you stay attuned. So let's walk through the 9 main types of nonverbal communication that you're going to want to pay attention to. Starting with facial expressions, your face is basically a billboard for your emotions. Clients will notice if you're smiling, furrowing your brow, or accidentally looking horrified when they say something vulnerable. So you might want to practice what I like to call resting counselor face. It's calm, it's open, it's human. And it's definitely not the I'm solving complex math problems in my head face or the oh no, what did you just say face? And then moving on to gestures like nodding, using your hands while you talk, or shrugging can help show a client that you're engaged. A small nod when a client is struggling to find their words can encourage them to keep going. Overdoing it, though, can make you look like one of those bobblehead dashboard toys. So just keep it natural. Don't overdo it. And then paralinguistics. So this is the tone, the loudness, the inflection. It's all about how you say something, not just the words that you choose. So your tone of voice, your volume, and your inflection can completely change the meaning of what you're communicating. So think about the sentence, I never said she didn't like you. Depending on where you put the emphasis, this sentence can mean totally different things. So we're just going to change putting the emphasis on each word, starting with I. I never said she didn't like you. So that implies that maybe somebody else did. I never said she didn't like you. Absolutely never. Total denial. I never said she didn't like you. So maybe I implied it, but I didn't say it. I never said she didn't like you. So maybe somebody else doesn't like you. I never said she didn't like you. So maybe she actually does like you. And I never said she didn't like you. Maybe she didn't love you, but she liked you. And finally, I never said she didn't like you. Maybe she didn't like somebody else, but you're fine. So, same exact words, 7 very different messages. And that's the power of paralinguistics. The bottom line here is that your voice is one of the most important tools as a counselor. Be thoughtful about your tone, your pacing, and your emphasis. Clients pick up on it even faster than your words. Then there's body language and posture. How you sit and move matters. Are you leaning forward with open arms? Are you turned away, tapping your foot, glancing at the clock? Your posture should say that I'm here with you. The 5th one is proxemics, or AKA personal space. Everybody has an invisible bubble around them. When you get too close, people notice. Sitting too close in a session can feel intrusive. Sitting too far away can feel cold. The sweet spot is generally about 3 to 4 feet apart, close enough to feel connected, but with enough room for safety and breathing space. I usually let my clients pick their chair first and then I sit down. That way they have a lot of control and safety in the room. 6th is eye gaze. So eye contact is essential, but it's also a dance, not a staring contest. Looking at your client when they're talking shows you're engaged. Staring into their soul without blinking, that's going to creep them out. At the same time, no eye contact, looking at the floor, your notes, or the clock, makes it feel like you don't care. Aim for natural, respectful eye contact. Look at your client for most of the time, but let your gaze shift naturally now and then. It's okay to blink, just please blink. And again, you're going to want to really pay attention to what your client is doing as far as eye contact, too. What they say with or without eye contact really tells a whole lot about their comfort level. The next one is called haptics, or it's just touch. Touch can be powerful, but in counseling, it's something that we have to be very careful with. A light handshake at the start might be appropriate if it fits your setting and the client's culture, but generally, touch in counseling is minimal and always client-centered, culturally sensitive, and professional. So when in doubt, don't initiate touch. And if a client asks for a hug, Really think about the pros and cons to this before you proceed. Next is appearance. So, like it or not, how you show up, your clothes, your grooming, even how you organize your office sends messages. Dressing neatly but comfortably can help a client feel more at ease. Showing up in a wrinkled t shirt and pajama pants, unless you're doing telehealth and they only really see it from the waist up, might send the wrong message about professionalism and respect. You don't have to look fancy, but you do need to look approachable, put together, and professional. And the last one on this list is artifacts, and that just means objects and images. So the objects that you surround yourself with, office decor, books, artwork, also communicate something. Having calming art on the walls, plants, and comfortable chairs signals that your office is a safe, welcoming space. A giant no whining poster behind your chair, probably not the vibe that you're going for. I worked with a counselor once, and her office was just jam packed with little yellow minions from that movie. It was just a little overwhelming. It was a small office to begin with, and like every square foot had something in it, and it was a minion with their little eyes just kind of staring at you. I think for some clients, it felt really nice and comfortable to know that this counselor was a little fun loving and liked some silliness in her life. For others, it didn't feel very professional. So just think about how artifacts can create atmosphere. Think about what your space says before your words even start. What kind of vibe are you going for? And one last really important note here: nonverbal communication isn't universal. Eye contact, personal space, gestures, all of these vary across culture, community, and individuals. Some clients may feel uncomfortable with direct eye contact. Some may need more distance to feel safe. Some may express emotions very subtly. So don't assume, pay attention, get curious. When in doubt, you can even ask, "Hey, I want to make sure that I'm respecting your comfort. Is there anything that you'd like me to know about how we interact here? Or is there anything that I can do to make you feel more safe in this environment?" Good counseling starts with meeting people where they are, and that includes how you read and use nonverbal communication. So we've talked about your presence, your nonverbals. This invites clients to show up and to open up. So now let's talk about the verbal side, what you actually say to encourage conversation. Good verbal invitations aren't complicated. They're simple, intentional ways of saying, "I'm listening, I want to understand more, and this space is yours." There are three main tools that you're going to practice: door openers, minimal encouragers, and thoughtful questions. Door openers are short statements that invite the client to talk without steering them too much. They create space without pressure. So that might sound like, "Tell me more about that." Or, "What would feel most helpful to start with today?" Or, "That sounds really important. Can you help me understand it a little bit better?" Door openers send a clear message: "You get to set the pace. I'm here to walk with you." They're especially helpful early in a session or when a client seems stuck. Then minimal encouragers are those small, subtle responses that show that you're engaged without interrupting the client's flow. These can be nonverbal like nods or verbal like short sounds or phrases. So examples would be like, "Mm-hmm, yeah," or gentle nodding, or brief echoes like, "Yeah, that makes sense," or "I hear you." Minimal encouragers keep the conversation going without grabbing the spotlight. They're like breadcrumbs leading the client further into their own story without you pulling or pushing them. And I just want you to be cautious here and be mindful about not overdoing it. If you're nodding so much that it looks like you're trying to shake your own head off, it's distracting. If you say "mm-hmm" after every word, clients might wonder if you're actually listening or just running on autopilot. So use them naturally like you would in a real conversation where you care. You also want to be careful with the word "yeah." It might imply that you're agreeing with what the client is saying, which we may not always want to be agreeing with it. Sometimes we want to challenge it a little bit. So if you just use "yeahs" on autopilot, check that. Make sure you're using it with intention. And then next, we want to look at thoughtful questioning. So as a new counselor, it's really easy to fall into what I call question machine mode, where you start firing off questions after question, like a police interrogation. Instead, think about thoughtful questioning as asking with intention. You're not just gathering information, you're helping the client explore. The question shouldn't be for you, they should be for the client's understanding. So here's a few important tips. We want to look at open-ended versus closed-ended questions. Closed-ended questions ask for a short answer, generally yes, no, or a number or a fact. Are you in school? Do you have a job? Did you eat breakfast today? Those are all closed-ended questions. You can answer that with yes or no. Open-ended questions invite fuller responses and reflection. What's it been like for you at school? Can you tell me about your work life right now? What was your favorite part of your breakfast this morning? In general, we lean towards open-ended questions in counseling, especially early on. They create space, they let clients tell their story their own way. There is a time and place for closed-ended questions, though, but too many closed-ended questions can make a session feel like a checklist, not a conversation, or even like an interrogation. We also want to look at avoiding leading and why questions. Leading questions are when you accidentally or maybe purposefully insert your own assumptions or opinions or values into what should be the client's process. So a leading question would be like, don't you think that it would be better if you talked to your boss about that? Clients can feel judged or boxed in, even if you meant well. And then why questions can make clients feel defensive. Why did you stay in that relationship so long? Most of the time, clients aren't sure why they did something. Asking why puts them on the spot to justify themselves. Instead, you might want to use softer questions like, what was going through your mind when that happened? Or what do you think kept you connected to them? So, same curiosity, but much safer landing. Verbal invitations, door openers, minimal encouragers, thoughtful questions are like gentle nudges that tell the client that it's safe to keep going and that you're curious and you want to hear more. And when you combine these with strong nonverbal presence that we talked about earlier, you're creating a counseling space where they can really start to grow. So this week, I really just want you to start noticing, are you leaving space for clients to talk? Are you using words to invite, not direct the conversation? It's a small shift, but it can make a massive difference. We spend a lot of time talking about what to do when you're inviting clients to share. So let's be honest for a second here. It's just as important to know what not to do. Even with the best intentions, new counselors, and honestly, even seasoned ones, can sometimes slip into habits that accidentally shut down the conversation instead of opening it up. So let's go over 3 of the most common communication roadblocks and how to avoid them. The first is advice giving, and it's probably the number one instinct that you're going to need to watch for. So an example would be if a client says, I'm not sure if I should leave my job. And you immediately are thinking, well, obviously you should leave. You deserve so much better. But jumping in with advice takes away the client's power and it turns you into the expert and them into passive recipients. And that's not counseling. In fact, it often leaves clients feeling misunderstood, minimized, or pressured. So we're going to want to avoid it by instead of telling them what to do, help them explore their options. What would it feel like if you stayed? What might change for you if you left? Counseling is about empowering clients to find their own answers, not handing them your answers. We also want to look at premature reassurance, and this one sneaks in easily, especially when we want to make somebody feel better. So an example would be a client saying, I feel like nobody will ever love me. And you jump in with, oh my goodness, of course they will. You're so amazing. Your heart's the right place. But the problem is that you just skipped past their pain. You reassured them before you really sat down with what they were trying to tell you. So we want to avoid it by slowing down. Instead of rushing to comfort, reflect what you're hearing. It sounds like you're feeling really alone right now. Give them a chance to feel heard before you try to fix. Or maybe don't try to fix at all. Often just being understood is more healing than anything that you could say. The third one I want to look at is oversharing or shifting focus to counselor. So when a client opens up, it can sometimes spark memories or emotions for you too, and that's totally cool. That's just your mirror neurons firing. You might find yourself wanting to share your own story to make them feel less alone. So an example would be a client saying, my mom and I barely speak anymore. And you respond with, oh man, me too. Let me tell you about that time that my mom and I didn't talk for 6 months. Now, who is the session about? It's not the client anymore. Self-disclosure can be powerful, but it has to be very limited, intentional, and always redirected back to the client. A good check-in is to ask yourself, am I sharing this for their benefit or for mine? When in doubt, stay focused on their story, not yours. Early on, it's going to be normal to want to jump in, solve problems, comfort pain, or connect through shared experiences, and that's just really you being human. But in counseling, our job isn't to fix or center on ourselves. It's to create space for the client to explore, heal, and grow. By avoiding these common roadblocks, you help keep that space open, safe, and focused on where it needs to be, on the client. We're getting to the end, and before we wrap up today, here are just some quick tips to help you get the most out of your first practice sessions. Relax and be present. I know it's tempting to overthink every move when you're starting out, but remember, you don't have to be perfect. Clients and your volunteers and your role plays aren't looking for perfection, they're looking for presence. Slow your breathing, settle in. Being with someone matters way more than saying exactly the right thing. You're going to want to focus more on listening than talking or fixing. Your main job this week isn't to solve problems. It's to listen, reflect, and create a safe space for somebody to be heard. If you catch yourself thinking, what advice should I give? Just pause, shift back to, what do they need me to hear right now? You want to pay attention to your nonverbals. Before you say a word, your body's already talking. So do a check-in. Are you sitting open and relaxed? Are you making eye contact without staring them down like you're trying to read their mind? Are you showing warmth through your posture and facial expressions? Sometimes the most powerful thing that you can say comes from how you show up physically. You're also going to want to practice silence without rushing to fill space. Silence is not your enemy. In fact, a well-timed pause can be a gift. It gives the client or your role play partner a chance to go deeper. If you ask a question in their silence, don't panic. Trust that something is happening in that space, even if it's not immediate. And for your practice this week, just keep it simple. Focus on creating an inviting space, use a few door openers, nod, listen, encourage. You're not expected to master everything all at once. This week is about getting comfortable with starting a conversation, not about doing therapy quite yet. When in doubt this week, be curious, slow down, be kind, listen more than you talk. You're building the foundation one moment at a time. That's exactly where you're supposed to be. So, wrapping up, I just want to leave you with a little encouragement for the road ahead. This course is about practice, not perfection. You're supposed to stumble a little. You're supposed to feel awkward at times. That's how learning happens, not by doing everything right, but by showing up, trying, reflecting, trying again. Try to fail. See what you can learn from your mistakes. Counseling is a skill that you build over time, like learning a new language. You don't become fluent by memorizing words. You become fluent by using them, even when you mess up a little. It's the same idea here. So do your assigned readings. It's chapters 1 through 3 in your textbook, and start to look at your first role play practice. Focus on using invitational skills. You don't have to fix anything. You're just practicing getting the conversation started and holding space. And as you prepare for your first practice sessions, just take a moment and think, what is one thing that you can bring into the room this week to help somebody feel heard? Maybe it's your attention. Maybe it's your patience. Maybe it's your willingness to sit with silence without rushing it away. Pick one thing, hold on to it, bring it with you, and that's where it starts.